and twice over a period of time, not just twice on the same day. So we are pleased. We are very, very, very pleased that this is the circumstance of the day. Having said that, I would also, on the flip side of that, is to announce that over the last 24 hours, we have tested over 300 Kenyans. Out of those, 22 have been tested as positive. This is the largest number that we have received in a single day. It is also commensurate with the fact that it is the largest number that we have tested also in a single day. Out of those 22, 13 are male and 9 are females. Let me also add that 21 out of the 22 cases are people who are currently in quarantine. And that tells you the importance of the exercise that we have been carrying out. And that it is lucky that we have found the 21 people in quarantine, because by now the 21 would also have passed it on to other people. And one case is in Mombasa Hospital. You'll be getting the statistics on all this in the leaflet that we are going to give you. There are 18 Kenyans, 2 Pakistanis, and 2 people from Cameroon, 2 Cameroon nationals. And that makes up the number of Kenyans we have now. In terms of country of origin, now please note, these are not people who are in those counties. These are not people who have been tested in those counties. And these are people who have not arrived in those counties because they are in quarantine. And they are quarantined as they came through the airport. So Kakamega County, the residents are as follows. Kakamega County, 1 resident. Kiambu County, 2 residents. Kilifi County, 1 resident. Machakos County, 1 resident. Mombasa County, 7 residents. Muranga County, 1 resident. Nairobi County, 1 resident. Nyamira, 1 resident. And international, the 4 that I have said, from 2 each, from Cameroon and from Pakistan. Ladies and gentlemen, fellow Kenyans, over the last 24 hours, 810 Italians have passed away. During the same period, 812 Spanish people have passed on as a result of the coronavirus disease. What this tells us is that we cannot emphasize enough what is likely to be ahead of us unless and until we adhere to the rules that we have established. Distancing, washing hands, and observing strictly what the government is saying. I would also like to add here that this disease knows no boundaries, not national boundaries, not political boundaries, not between rich and poor. We are all affected in the same way. And that is why I would like to persuade our leaders in and out of Parliament that tafadhali, when you speak to this issue, don't speak in a manner that brings division. For example, the acting DG is misquoted today, and he'll speak for himself, as having said that he didn't know that there was a multi-agency activity going on, as if there is a division. between the arms of government, I would like to state very, very clearly, there is absolutely no difference. This is a total government effort. The leader of all of us is the president, who is guiding us through this whole process. The transport ministry is involved in matters transport. The police and the security authorities are involved in tracing. When it comes to tracing of contacts, and we are tracing thousands of them now, when it comes to tracing of contacts, the Ministry of Health does not have the capacity to trace contacts. The Ministry of Health accompanies the agencies that are assisting the Ministry of Health to trace the people. So if you get a visit from another arm of government, then you cannot say, that is not to say that the agencies are not working together. As a matter of fact, that is a demonstration that the agencies in government are all working in unison and in a manner that indeed has not happened in a long time. We are working very well together. So it is not true to insinuate that there might be gaps or differences. There is not, and there is none. I would also like to say, this morning when Brenda and Brian were talking to Kenyans, they also emphasized the same. And they said that they were grateful to the government, and the president especially thanked the little girl called Brenda, because she is the one who brought herself to Bagathi, and because of her, we have been able to track and quarantine people who now have been spreading the virus. So I would just like to say, and to echo her as a hero, as a Kenyan hero, to say if everybody took similar responsibility, quarantine yourself if you know you have traveled, because so many cases are out of people who traveled, who are asked to quarantine themselves, and they did not. And just because they are not feeling well, they decided they have they don't have the virus. So I would like to urge, please quarantine yourself if you have been traveling. Quarantine yourself if you begin to feel that you are not feeling well. Quarantine yourself until you get help, or at least until our officers are with you. Finally, ningetaka tu kuzungumza kidogo mambo ya hao Wakenya wawili ambao leo hii daktari amesema wako sawa kabisa, wamepona na wako katika pale walitoka, wako kwao nyumbani. Na tunashukuru Mungu kwa kutuhurumia kama Wakenya, kuhurumia hao watu wawili, na tunafurahia hiyo maneno. Rais mwenyewe alifurahia hiyo maneno sana leo katika na kuzungumza na hao wawili katika mkutano wa video, na vile vile Wakenya wengi wamesema vile wamefurahia hiyo maneno. Lakini hii ni kusema nini? Ni kumaanisha ya kwamba tukifanya vile serikali inataka, tukifuata maagizo, maelekezo ya serikali, basi ienda ikawa tunaweza kusaidia Wakenya wengi, tunaweza kuokoa watu wengi ambao ienda wakafa, kwa sababu hii virusi iko hapa. Hii virusi inaua watu wengi sana katika hii dunia. Tangu wakati huu watu karibu 12,000 wamekufa kwa sababu ya hii virusi. Kwa hivyo sisi tukiona vile watu wanaangamizwa huko Ulaya, sisi pia ni lazima tujikinge. Tafadhalini wenzangu, ni lazima tujikinge ndio tusifike hapo pahali ambapo Kila siku tunasikia watu 800, watu 900, watu 700 wamekufa. Jameni, washa tufuate maagizo ya serikali, tusije tukafika hapo. So I want to thank you all very, very much, and just add that as on the matters of coordination of government and on the issues of taking care of the wananchi, that food trucks, just like CS Munya said yesterday, that we have not stopped commerce because of the curfew. Food trucks are free to move in the evening, and the police have been advised the same. There are also vehicles moving across the border. For example, vehicles moving food and other items and medicines from Mombasa, the port of Mombasa, heading for neighboring countries. You know, so that is still going on. What we are avoiding is contacts in the evening in a manner that can reduce social distancing. So I am thanking those who are continuing to observe the curfew. I am thanking those employers who continue to release their people on time. And I am thanking those employers who continue to support, you know, Kenyans and employees who have supported the companies that they work for many years and for a long time. I'm also thanking the business community for being part of this effort to support government. I am thanking the donor community, the World Bank, the World Health Organization, UNEP, UNON, and all the others who are working with us, the Clinton Foundation, and all other organizations that are currently working with us to increase the supply and readiness for what we can see coming at us ahead. So I am just asking for unified effort and to say that Kenyans, when you are in a ship that is going towards a storm, you don't start arguing or fighting within the ship. You get together to hold on so that you can weather the storm. I thank you.